All right, let's go ahead and talk about the dermis. So, in general, the dermis is going to be irregular, dense, fibrous connective tissue. It is not epithelial tissue. It is also going to vary in thickness, just like the epidermis. It will be thicker on your palms and soles of your feet. The dorsal surfaces, so your back, will be thicker than the ventral surfaces, as well as the lateral surfaces will be thicker than the medial surfaces. So we will have some variation depending on where we are. We're not going to have a lot of cells present. We will have some fibroblasts, we'll have some macrophages, we'll have some adipocytes, but other than that, it's going to be mostly just a matrix that is thick with protein fibers, all three of the big heavy hitters, collagen, elastin, and reticular. The location for blood vessels, nerves, and sensory receptors, glands, and hair follicles will be the dermis as well. The dermis is actually divided into two sections, the papillary dermis and reticular dermis. Papillary dermis is the upper fifth and consists of loose areolar connective tissue. This is an arena, basically, for immune cells to fight invaders, especially if there's a cut in the epidermis. This is going to project upward as dermal papillae, hence papillary dermis, to interdigitate and form a strong connection with the epidermis. So it's because of these bumpings that allow for this to anchor together and not separate. We will also have a heavy investure of blood vessels here. This will supply that lower layer of the epidermis with the nutrients and oxygen that it needs in order to duplicate and survive. These blood vessels, though, are going to play a role in thermoregulation. They are going to constrict when it is cold outside. Constricting is going to decrease blood flow, meaning we're going to lose less heat through our blood vessels. And when it's warm outside, or if your internal temperature is warm, I should say, they're going to dilate or expand. And this again will allow for thermoregulation. If we are passing more blood through these blood vessels, we're going to have more heat radiating out of our body. We're also going to have multiple sensory receptors located in this section of the dermis. The reticular dermis is a little lower, 4/5 or 80%, and is our dense irregular connective tissue. What makes it very unique and distinct is going to be when we look at it under a microscope, we're going to see horizontally running collagen fibers. This right in here, they're running horizontally. This is going to give skin strength and resiliency. The elastin that's going to be located here is going to give skin the ability to stretch and recoil. The vast majority of the appendages of the skin, so nail bed, hair follicles, all that stuff, is located within this dermis. So, when we say the appendages of the skin, what are we talking about? We're talking about the sebaceous glands, otherwise known as sebum glands. These are going to secrete an oily substance into the hair follicles. We're going to have sudoriferous glands. These are sweat glands. Ceruminous glands, not pictured in this diagram. Ceruminous glands, we'll talk about in a bit. Hair and nails. And again, nails aren't seen in this image. Let's start with our hair. Hair is a flexible strand made of highly keratinized dead cells. And if that statement sounds familiar, it's because it's the exact same statement we said about the outermost layer of your skin. So hair is very similar to that outer layer. Keratin is going to be in both hair and nails, but it's the hard version of the keratin. So keratin does come in two formats, soft and hard. The keratin that is found in your outer layer of the epithelial cells is soft keratin. Hard keratin, however, is a stiffer, more compact version. It's tougher, and this is what allows it to maintain the shape and form and not just slough off when things bump into it. So it gives hair its ability to stay, basically, and then nails as well. Hair is made by the living hair follicle. Once the skin or the hair leaves the hair follicle, it's exactly like the skin. It dies. And so by the time it reaches the surface of your skin, that is dead cells. So your hair is all dead. It's all dead. So why do we have hair? Hair is going to help maintain warmth. It's also going to alert the body to the presence of insects on the skin. It's going to help guard the scalp specifically against physical trauma, heat loss, and sunlight. Now, that does not mean you cannot get skin cancer on your scalp. It's just less likely. And then hair is going to be distributed over the entire skin surface except palms, soles, lips, nipples, and portions of the external genitalia. Otherwise, you're going to have hair everywhere. And that's on purpose. What's the anatomy of hair? Yes, hair has anatomy. The shaft of the hair is going to have an inner medullary layer, an outer, or actually it's technically the middle cortex layer, and this is where your pigments are going to be found, as well as air spaces, and then an outer cuticle, which is a hard keratin layer. The root is very similar to the shaft, but it's going to be located within the dermis. So the shaft is the hair once it has left the skin. The follicle is the embedded portion of the hair. It supports the shaft and the root, and that is where all growth and division is going to occur. Located within that shaft is going to be the bulb. This is actually where that division occurs. It's an enlarged layered area at the base where hair is generated. It has a papilla, which is an areolar connective tissue and has blood vessels that will supply the nutrients, and a matrix, which is a germination layer, similar to the stratum bacelli, that's actually going to build the hair shaft. There will be a sebaceous gland connected to the root, and this is going to release oil, which is going to coat the hair shaft, and will also have an erector pillae muscle, and that is a smooth muscle that is going to contract to cause goosebumps. So here's our goosebumps. What are goosebumps? The contracting of this smooth muscle band is going to generate heat. So the erector pillae is involved in thermoregulation and generating heat. Now, hair color, brown, black hair is due to melanin that it has been deposited in the shaft of the hair. Red and blonde is variance on melanin, so you still have melanin depositions, but you also have iron and sulfur depositions as well, and that is going to be due to genetics. Gray hair is a loss of the melanocytes. This is going to reduce the amount of pigments that are going to be deposited, and that's why it's gray. You're seeing more of the natural color of the hair. What it is without the dyes. And then white hair is due to air bubbles accumulating in the cortex. So you have a lot of those air bubbles. Hair and hormones. All right. If you have PCOS, you know all about this. So testosterone is responsible for hair, specifically in male presenters, but even in women. Women have testosterone too. So secretion of testosterone is going to increase at puberty. There is a male pattern of hair growth and distribution that will begin here. There's a condition called hirsutism. This is when you have an excess testosterone production. Typically, this is going to be a tumor or hormonal imbalance. This condition we call it this condition when you have excess hair production in females or in prepubertal males. So basically, if you are male and you're post-puberty, this is not a condition you'll be labeled with. You have a lot of hair. Here's the thing. PCOS, polycystic ovarian syndrome, is one of the causes for this in females. There are a couple other reasons, but this is one of them. Male pattern baldness. This is a genetic predisposition, so it is a sex-linked trait. Testosterone is going to actually inhibit scalp hair growth in these particular individuals instead of promoting it. There's a couple of medications that can be used to help combat this, even though it is genetic. Finasteride, which is also known as Propecia, it's an anti-testosterone agent and has to be taken for the remainder of life. So this is going to affect not just hair, but anything that is dependent upon testosterone. And then we have minoxidil, which is otherwise known as Rogaine, and that is an anti-hypertensive medication. It is going to widen blood vessels, increasing blood flow, and is typically applied topically daily to promote growth in people with reduced hair growth. Typically, this is going to work a little bit, but it's not going to reverse truly bald individuals. As long as there's still a hair bulb there, this will work. But if there's no hair bulb, this will not work. All right, sebaceous oil glands. Sebaceous oil glands are connected to the hair follicle, as we mentioned, so they're going to be located in the dermis. They secrete directly into the follicle. However, some will secrete directly onto the skin. The shape is going to differ depending on the location of this particular gland, and they secrete sebum, otherwise known as oil. So what is sebum? It is a combination of fats, cholesterol, proteins, and inorganic salts that is secreted in order to prevent hair from drying out. When it is secreted onto the surface of the skin, it is going to help prevent water evaporation from the skin. It's also going to help keep the skin soft and supple and inhibit the growth of many bacteria. Now you might be going, wait, well, what about pimples? And there's a blocked sebum or oil gland. Comes infected, has bacteria growing in it. That is due to an overaccumulation. That's going to be something completely different. Sudoriferous or sweat glands. These guys are going to be a combination of plasma filtrate, so water, salts, urea, uric acid, amino acids, ammonia, sugar, lactic acid, ascorbic acid, and pheromones for sexual attraction. That's why some people find some individuals more attractive when they're sweaty. Of course, it doesn't work on all. Some people find it the opposite. Welcome to biology. It's confusing. pH of sweat is typically going to be between 4 and 6 on the acid side of the scale. This salty and acidic solution, therefore, is going to inhibit most bacterial growth, but not all. It's also going to help maintain body temperature. How it maintains body temperature is by being a water-based compound. It will be on the surface of the skin. The heat we radiate out of our skin is going to cause sweat to evaporate. And when the water evaporates, it pulls heat off of the surface that it's on. So it's going to pull heat off of our skin, cooling us down. This is why we have things like dry heat and wet heat. In a wet heat, a humid environment, we sweat, but because the air is so heavy with water already, that water, sweat, does not evaporate, leaving us feeling hotter and stickier. In a dry heat environment, the humidity is low enough, the air is dry enough that when we sweat, the water is evaporated off of our skin into the air. It's going to pull heat with it when it does that, and it is actually going to cool us off. So 100 degrees in humid is going to feel different from 100 degrees in dry. It's still hot and disgusting, but it will be different. There are two types of sweat glands, eccrine and apocrine. Eccrine sweat glands are the most abundant. We have approximately 3 to 4 million. They are found especially in the palm, soles, and forehead regions. This major function is going to be sweating for thermoregulation, so they're going to have a very watery product. They're going to be located in the dermis and have a duct to the surface of the skin. And as we mentioned, help prevent bacterial reproduction. Apocrine sweat glands, on the other hand, are going to be found primarily in the axillary, pubic, and anal regions of the body and facial regions in men only. These guys are going to be larger than your sweat glands, and the ducts are actually going to empty into your hair follicles, so they're not going to come straight to the surface of the skin. The sweat secreted by your apocrine sweat glands is going to be thicker and less watery, and this is because it's going to contain more lipids and proteins than the eccrine product. This is going to be secreted more during emotional stress. So if you've ever noticed that when you are stressed out, you tend to sweat more in the armpits, noticeable, especially if you're wearing a t-shirt and you're like, oh, pit stains. That's apocrine glands. It's an emotional stress response. Also, sexual arousal. So could be either or. This is also going to be degraded, though, by epidermal bacteria, so it does not inhibit bacterial growth, but it is also what causes your pits to smell. It is the breakdown of the sweat by bacteria, creating a foul odor. So if you don't sweat, then you won't have the foul odor, which is, catch-22 there. It's not something you can consciously control. All right. Modified sweat glands come in two types. Ceramides, these are going to be found in places where we need to protect against ectoparasites, bugs, which means they are found primarily in the external ear canal lining, the inner lining of that external ear canal. So it's going to secrete a sticky, waxy substance called cerumen or earwax. This is going to combine with sebum and dead epidermal cells to form a bitter compound that's going to offer a barrier to entry of the ear. This is your earwax. This is protective. The other place we have modified sweat glands is going to be in the mammary glands. They are going to be specialized to produce milk. So these are going to be hormonally regulated by estrogens, prolactin, and oxytocin hormones, but they are modified apocrine glands. Exocrine glands are going to come in three formats. Merocrine, which produce products that are secreted via a chemical release, so pancreas, sweat, salivary glands. Apocrine, which pinch off portions of the cells. We mentioned these are in the mammary. And holocrine, which their products are secreted by the rupture of gland cells. These are our sebaceous glands. Nails. Nails are tightly packed, hard keratinized cells. The nail matrix is going to be located under the root of the nail. It's the site of nail growth. It's going to transform normal skin cells into nail cells, which will then push forward. Your fingernail is going to grow about 1 millimeter per week. Your toes are a little bit slower than that. Typically, the longer the finger, the greater the growth rate. Here's the thing. These are the sections, regions of the nail: free edge, body, lateral nail fold, cuticle, otherwise known as the epichyme. And this half moon crescent right here is the lunella. The lunella is actually where that growth site is. This is the root of the nail. This is why if you ever damage the lunella, you catch it in the door frame, pinch it, whatever the case may be, hit it with a book really hard, causes damage there, you get a white line that grows into the nail bed. and it will eventually go towards that free edge until it grows out because you clipped your nails. That white line is showing that while that nail was forming in the nail bed, it was damaged. Nails are also really, really important because they will they will be indicators of certain types of conditions, from psoriatic arthritis, so psoriasis, to heart disease, to nutritional deficiencies. All of that is going to be involved with the nails. Here's the nail unit again. Last but not least, we are going to have the subcutaneous tissue, aka the hypodermis or the superficial fossa. This is going to be located under the dermis, so it's deep to the dermis, and be composed primarily of adipose tissue plus some areolar connective tissue. Here we're going to have a storage site for fatty acids. We're also going to have an insulatory effect because of those adipocytes, and we're also going to have padding because of those adipocytes. This is going to anchor the skin to the underlying structures, especially muscles, and distribution will be different depending upon if you are estrogen dominant or testosterone dominant. Last but not least, we are briefly going to touch on skin cancer. Skin takes a tremendous amount of abuse, and anytime we have trauma to a cell, we have a risk of DNA mutations. So a serious disorder that can result due to this trauma is skin cancer. Cancer is defined as being an uncontrolled cell division and growth. Can be an abnormal or a completely normal cell, so a cell that does belong, that is suddenly dividing and growing uncontrollably. We have three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma, if you're going to have a cancer, is the one that you want. Now you might be going, whoa, Vital, skin cancer, bad. And that is 100% true. Skin cancer is not something to play around with. However, basal cell carcinoma is about as non-malignant, non-aggressive as a cancer can get. You can have a mole that has become cancerous, if it's basal cell carcinoma, and have it for 5-10 years, and it's easily treated. There's a cream that you can put on for twice a day for like 3 months, or they can do cryosurgery and surgically remove it, and you're good to go. Basal cell carcinoma is so non-invasive that finding a stage 2, 3, or 4 case of basal cell carcinoma is extraordinarily rare. It is not to be confused with the other two types, squamous cell and malignant melanoma, which are the ones that we are worried about. Squamous cell carcinoma and malignant melanoma are both highly aggressive. They will mutate and spread rapidly, and they are the reason that we recommend doing mole checks every month. So mole checks follow the ABCDE rule. You're looking for asymmetrical moles, moles with irregular borderlines, moles with multiple colors, moles with a diameter over the size of 6 millimeters, which is a pencil eraser, and moles that are elevated and or have changed. And it's an and or type of situation. If I have a mole that is larger than 6 millimeters, but it has remained the same since I started paying attention to it, is it a problem? No, you still want to get looked at just to make sure by a professional, but it's nothing to worry about. You just want to keep an eye on it. If it changes, that's when we're worried. So one of the things I strongly recommend all of my patients do and students is start checking your moles every single month. Set a day, first of the month, last of the month, whatever it may be, and check your moles. Now, front of the body, that's nice and easy. You can very easily see all the moles on the front of your body, and usually your entire arms. However, you also want to have a friend, family, partner, somebody check your scalp, because you have moles on your scalp. You want to make sure those remain the same, and your back. So back of the legs. Now, if depending on your partner, they might go, I don't know. We have phones. Have them snap a picture of it, and then you can look at it. Another reason for this is if you have a mole, like you're like looking at it, I'm like, I'm not sure if it changed or not. Snap a picture of it, and then when you go to look at it next month, you can refer to that picture. And if you have a mole that you think is a problem, bring those pictures with you to your dermatology appointment. Your dermatologist sees you once. So if you bring pictures, okay, this was January 1st, this was February 1st, and this was March 1st, and these are what they look like, they can actually get a better feel for, has this changed? Is this one that we need to worry about? All right, as I mentioned, basal cell carcinoma. We'll actually talk more about all of these in the next audio.